Kidney failure can happen to anyone, anytime. But whilst this is an illness that will always require treatment, you can, if you manage your condition effectively, continue to live a full life. In 1991, I discovered during my pregnancy that I had a problem with my kidneys. 7 years on, and 2 children later, doctors finally diagnosed a genetic condition, and in 2002, I reached end-stage renal failure. During my time as a renal patient, I found that by working with my renal team and really understanding the condition, I was able to make choices about aspects of my treatment, which helped to reduce the impact it had on my family and myself. In this DVD, you'll find out more about end-stage renal failure, the diet, the medication and treatment choices you have available to you. We'll also highlight those places where you can find additional information on some key topics. Alongside advice from medical professionals, we'll introduce you to patients who will explain the pros and cons of living with their choice of dialysis treatment. We've also collected a number of practical tips, things we wish we had known from patients who have lived with kidney failure, which they found have made life easier. Above all, whatever stage you're at in your treatment, it's important that you understand your condition and develop an effective partnership with your medical team. This approach enables patients to make the right decisions about their own treatment.
I think if they have much more knowledge and understanding, they can come to us and tell us how they're feeling much better. We can interact much better with them. But I think it's up to us to provide the forum that they can become much more enabled.
We give patients the information they need to help them take control of their disease, and that will then lead to a better sense of well-being and better outcomes for them in the long term.
Patients are now really partners with the healthcare professionals, partners at every level of the decision making.
You get support at home, but you do need support off the doctors. But I find that I can go and discuss anything with them. But the partnership we've got, it's two-way.
In 2007, nephrologist Dr. Donal O'Donoghue was appointed as the first National Clinical Director for Kidney Services. He's currently focusing on raising renal issues up the political agenda and improving the provision of renal services.
In kidney medicine, we've got a national service framework. The key elements are early detection and management of early kidney disease in primary care, preparation and choice for people approaching dialysis and transplantation, good quality vascular access for people on haemodialysis, safety and quality of care for people on dialysis and with transplants, and of course transplantation for all who can benefit from it.
Whilst renal services across the UK are improving, in order to ensure you get the best treatment, you need to look to the future and plan how you're going to live your life. As kidney patients, we have a lot to deal with. From coming to terms with our diagnosis, through the hospital visits and treatments, it can at times be hard to think positively about the future. But I found that by remaining positive, looking practically at how I was going to move forward, and actively seeking out the support I needed, I was able to make a difference to the quality of my life. I was able to actively manage my illness. Remember, you don't have to allow your condition to control your life. This hasn't just been my experience, other patients have found the same.
It is a lifelong thing. As I've proved myself, I'm now on dialysis for the second time. But you have got to realise it isn't the end of the world and that life can go on as normal while you're on dialysis.
There's always room for improvement. You should never stop. You should always look to move forward and look to the future.
Just think positive about it all. It's not the end of the world, it's the beginning of a new life for you.
Mentally and physically, it's all up here and all down there. Yes, I suffer from renal failure, but I've made that into a positive rather than a negative.
Your renal team are a great source of support and advice, not just for you, but for carers and other members of your family. Getting the right information at the right time can make a real difference, and staff are constantly looking at ways to improve that two-way communication.
I think it's very important that patients have a strong relationship with the consultant and with the wider multi-professional kidney team. They have a very, very important role, and that role is a lot to do with being a resource for the patient.
And it's about tailoring what we tell patients to what they need to and want to know. How are you doing?
Not too bad.
Excellent. There is that tendency to want to protect people by not telling them, the good and the bad. Certainly a lot of patients have identified they really want to know everything and just be truthful and honest with them.
So just how do you get the best from your contact with the unit?
Treat the clinic appointment as your opportunity. It's a fantastic opportunity to pick the brains of people who really know a lot about the illness. They know a lot about the illness, but the patient knows a lot about how it's affecting them, and it's really important to get that across to the doctors.
You get a lot of information often given to you very, very quickly, and it's easy to forget.
Go through at the end what you've discussed. Write down if you need to while you're sitting there what the doctor's told you. It gives you something to reflect back on.
Also, if you bring someone along with you, you can prime them beforehand and let them know exactly what you want to get out of the visit, and if you find that it's not going in the right direction, they can help you bring the consultation back on track.
Get back in touch. Don't sit at home worrying about something. That doesn't help anybody.
The relationship between patient and unit will be long term, so it's important to build and maintain strong links with your renal staff.
The doctors and nurses come to work in the morning, in general, wanting to do their best they can for the patients. So there is already there at the start a positive relationship.
You've got to be understanding, you've got to be on that level of communication to each other. You've got to have that trust, and they've got to have that trust in you as well.
By having this good relationship, you're open to ask any questions that concern you. Anything that you're not sure about, you don't understand, you must ask them.
Involving anyone really close to you, a partner, other family or friend in what's going on can really help. Not only can you provide each other with emotional support, but once they understand your condition, they'll be in a better position to offer practical assistance.
We're very happy to involve family members in clinic attendances and have them visit the unit, and we speak to family members in very much the same way that we speak to the patients. We regard it all part of the same deal.
In some of the best areas, or the best cases, it's when the actual carer becomes almost an expert in the condition, as they invariably do. And that helps both the patient and the carer to sometimes share information, to talk openly about the condition and to think more positively about it.
Be selective about the websites and blogs that you visit. Some of them, particularly the American ones, can be full of doom and gloom. All the websites on this DVD will give you sensible, helpful and practical support.
Not all medics across the world speak English, so if you are travelling abroad, take a card or a letter explaining your condition in the language of the country that you're visiting.
Life is a challenge for everyone. We all have good days and bad days. You'll manage your illness much better if you don't blame it every time something goes wrong.
Even if you're a positive person, there will be times when you're feeling low, so it's good to have some emotional support when you need it.